Good morning, everyone. Welcome to our MOTS EDI webinar, and today is September 7th, 9 o'clock. Thank you all for joining. We have a nice, good crowd, and with me are my co-workers today, and you'll hear them during the meeting. And Jody is here, Justin, Kayla, and Mary. And let me get the agenda for you. The webinar is recorded. And for those of you who would like to share the webinar with coworkers or won't be able to finish listening to our webinar because something comes up, we know how busy life and work can be, and something can come up and you can finish it later. It's usually within a day or two. It's getting pretty quickly these days to get it back to our website, and you can find them there. We always have the last two webinars out there because we figured relevancy is important. So the last two webinars should be out there. Or if you think a coworker would be interested to review bits and pieces, or you would like to get some bits and pieces reviewed one more time, you can always find them there. So, and we archive the old ones, so in case you are wondering about some other pieces that we've done in the past, you can always ask for us. For those of you who have questions, there is a question box in your pop-up little panel that showed up when you joined, and you can type in your questions, and then hopefully myself or somebody from our team can answer it. It's usually the person who's not talking that does the answering the question. So let's get going. If there's anything that I missed, let's start with the purpose. Why do we do these webinars? Well, pretty sure you are all familiar why we are doing this, but of course we want to give you information. We have a busy world, and our behavioral health world has lots of systems, and all those systems have sometimes changes or rules in the legislature happens. There's federal changes that might happen. So whenever anything changes, we'd like to inform you as quickly as possible and as thorough as possible. So that's why we use these webinars. So data issues is something that is close to my heart and a lot of my coworkers. And if there are issues, if there's certain parts of the information that seem to be not coming through properly, or if we have issues with data that looks off for some reason with counties or providers or systems that might not get something through properly, then we'll discuss it here, and it might be helpful for everybody. As I mentioned, your feedback is very important. If you have any questions, issues, suggestions, you can always place them in there, and we can hopefully do something with that. And part of that could be some ideas for a future webinar topic. If you feel very strongly about one of the things that's currently happening a lot is the Real D and the SOGI information about getting changes in how we collect data and what data we collect. So we'd love to hear from you over there. So, and hopefully any questions you might have today or had in the past, and we still haven't answered them. Hopefully we can answer your questions today. So. And I see a question about the website says the webinar is at 10. No, it should be from 9 to 10. They're always, oh, there you go. Jody gave the right answer. We'll get to that in a little bit, Ronnie. Yeah, you're way ahead of us. Well, but we'll get to that. What the other webinar at 10 o'clock. It's a webinar, but not the same webinar. So, got it.
Yeah, there's two different webinars.
Yeah.
Just ended up being back to back and slightly similar. So in naming. So we apologize for that. But for those of you that have signed up for 9 and 10, we look forward to a couple hours with you. And if we end early, maybe a little break in between. Thank you.
Excellent. Thank you, Jody. Okay, let's give the microphone to Kayla about some news updates. Breaking news, Kayla? If you unmute yourself, that might be helpful.
Can you hear me okay now, Pete?
Yes, I can. Yep, sounds great. Struggling with the two headsets and the microphones and trying to connect them. we had a little practice run yesterday, and Kayla was also struggling with her audio a little bit. And it happens, especially if you're working from home and you have certain connections setting up and you work through the VPN or through the Citrix. We have different ways of connecting from our home. I'm in the office at the moment, so I have no excuse for, although the system can go down here as well. That happens once in a while, but not that often. And I kind of like being in the office, having two screens, and everything is nicely set up. Okay, it looks like Kayla is not picking up on it. So why don't I give you guys a little information about what you guys already see here. And that is, we have several new systems that some of you might have heard of or might not have heard of. And one of these is the CLICS, and that's a certification and licensing. And we had the old system stabilized, and the new licensing printing is coming pretty soon to some big improvements, and hopefully that system will be ready and more accessible for our organization, because that's one of the things. It was an old system that was kind of kept by the certification unit, and nobody had really access. So hopefully with the new version, we all have more access, and we might be able to integrate it with some other systems, because it's very important for our system, for mods, to know who is licensed and certified, to get that information in there. So what's happening in the behavior health data warehouse, I'll explain the acronyms that we have. And it is in progress, and it's going to take a little longer than we thought, but we are finishing sprint 2. It's almost done, and sprint 3 is starting next week, Monday, I think, is the goal. So the whole project is expected to be completed the beginning of 2023, and that could be January, February, March. That's still kind of the beginning. So, but we're getting there. We had some reshuffling and some rescheduling, but it's doing pretty good. So the next thing, of course, very important for you guys, or one of the most important things, is ROADS, the ROAD system, the Resilient Outcomes Analysis and Data Submission system. See, that's why we have the ROAD system. So a lot of people put the S at the end and call that the system, but we have the ROADS system. The contractor used to be Cambria, but now has been bought up by Ernst & Young, and that little emblem here is the EY is for Ernst & Young. So if you see that, then you know they might leave it in bits and pieces that you might see here or there, then you know what it's about. So one of the things that we, and Jody hinted at it, is provider engagement plus EHR vendor. We need engagement from outside, everybody using our system and currently involved in mods. And if we are changing that, so we're going to replace it with roads, we definitely want your input. So the webinar that Jody was talking about earlier is about the provider and vendor engagement. So if you sign up, then that would be great. The link in the chat, and I'm not seeing a link in the chat, but maybe somebody can sort that out for me. So, because we are not in Teams, so I think that was a little mix-up in there. So, but if you have any questions about the new system or any of the other system, the data warehouse or CLICS, or you can always find us at Mod Support. But it has changed, because it has, and I think we mentioned it last time, because it's been a month, a little over a month now, but it's still mods.support, but at odhsoha.oregon.gov. It used to be dhsoha.state.or.us. We are all moving to oregon.gov, and I think our work emails will also be going to in that direction, is what I've understood. So, okay, I hope I didn't miss anything, but Kayla can always jump in when she gets her thing sorted out. So, okay, that was the news update. And then we're going back to Jody, EDI provider engagement, like clockwork. Go ahead, Jody.
All right. Thanks, Pete. And sorry, everybody, for the confusion. It was definitely the one we were having today for our normal mods webinar, which we all appreciate you being here. And then, you know, our provider engagement sessions, as Pete and a lot of you have mentioned in the chat, and hopefully you're seeing my answers. The road system is going to be, the MOTS replacement enhanced system plus more. So we're going to cover what roads is, what it means to all of you, what it means to your EHR systems, what you may see for changes, and actually, pleasantly for a lot of you, you'll see some of the similarities because administrative burden, reducing that. We've heard from a lot of you. Our management's been attending different sessions externally with many of you, and we've heard the concerns and feedback that's been given up to this point. And so reducing administrative burden on reporting as a whole to the Health Systems Division for Behavioral Health and Addictions has been one of the things that we're trying to streamline. So we're going to cover what that is, what that means, and how it might impact you. So for those of you that signed up for the one for today, we'll be doing that right after this one. For some of you, I will, if somebody hasn't put the link in one of the answer boxes or the chat, I will as soon as I get done here.
Kayla already did that. She was way ahead of me. I was still trying to find where it was, but we have the little chat here, of course, and I forgot about that because I was looking in the questions and I didn't see it, but it's in the chat there, so send to everybody. So,
yeah. Awesome. And so the reason there's multiple provider engagement sessions is so that everybody could attend. We had a lot of response and registrations. So if you go to the link that Kayla provided in the chat and you do not see September 7th as an option, that is because initially that was closed because the registration was, there were so many attendees. If for some reason you're on this webinar, you thought this webinar was that webinar, and you can only really attend today, put it in the questions or the chat or however you need to tell us, and Kayla can see if there's a way we can get an exception to get you into today's at 10 o'clock in the event that you thought that was what you were signed up for. Otherwise, we have two of them next week on the 13th and the 14th. How to register is in the chat. I think many of you are going to be very, very pleased with the feedback and the information that we got as we move forward with roads. And this system will be a lot more, have the data a lot more visible and interactive for you all that you submit to us. So anyway, so that, Pete, unless there's any additional questions, again, just the different sessions are different opportunities to hear the same information or very similar. I might say a few things a little differently each time, or Kayla might, but other than that, it should be the same content. Catherine says, name answer. Catherine says,
I signed up, but I haven't received the link. Yeah, I'm not really sure.
This is Kayla.
You
I
guys
will
can
send
take
out
a
that link again in about 15 minutes to folks who are signing up now who signed up recently.
Okay. Cool. Good idea. Okay. Let's get back to the agenda, and it's number 5, upcoming changes. Mary.
One quick question, Pete. Is Deb Curry
the confirmation of signing up? Catherine didn't receive that.
Right, but Debbie Curry wants to know if we've selected dates. I guess it might pertain to others. If you attend these, there will be additional dates for EHR vendors and their providers, the separate engagement sessions. So if you have a particular EHR, for example, Ocean, Dr. Cloud, Credible, Qualifax, different ones, we are going to be having additional sessions for just that EHR and all of the people that utilize their system, so we can capture any uniquenesses to those similar groups. So they are not yet identified, Debbie, but we will be getting them out. Yep, sorry, Pete.
No, it's we're on the topic, so go for it. So okay, cool, thank you. Okay, sorry about that. Mary, I was kind of opening the floor for you, but people keep jumping in. So, but that's the nice thing about it. I like it's interactive. So, but I'll shut them all up.
Thanks, Pete. So I just wanted to talk to you briefly. If you have any changes in your users, in your business, like you're selling your business or you're changing your name, you're closing, or you're changing the type of treatment you provide, please let us know, because sometimes we just kind of stumble upon it when we send an email, asking for information, and we find, oh, well, this is new. So it's just helpful for us so that we can keep up to date with the information that we need in order to provide you with the best service that we can. So, uh, and if you know that, I see Maria says that our agency will be getting a new name. When should we notify? Uh, as soon as, if you can just let us know that is in the works, and so that's on our radar screen, we'd appreciate it. And I see Jessica has no. Does anyone on your team know how we let OHA know that we have a new executive director? Um, uh, yes, that's a good question. You probably would. You could probably send an email to us, but I'm thinking that maybe you contact the licensing and certification team.
It's probably more important to the program people, unless
Yes.
the executive director is in the MOD system as one of the main contacts, then we can change the profile of the agency if the exec is in there. But so it kind of depends, Jessica, if it's if you are the main contact for mods or the new rows, then yeah, send an email and we'll probably ask around, because it's, I'm assuming, more the program specialist that would like to know that.
Yes, thank you. Or if the executive director is part of the contact for your access agreement,
Right.
that would be useful for MOTS to know. So, so thank you, everybody, and thank you, Maria and Jessica, for your questions.
Excellent. Thank you, Mary. Okay, and then I go to Jody. It's up to you again, Jody. Yep. Two slides.
Excellent. So we did have some screenshots that we're having a little bit of an issue getting them in here. So lots EDI results files and an Excel import instructions. So I've been working with some new MOT system administrators and for organizations, and as well I've been working for some that have been using MOTS for quite a while. So there's many different ways that the MOTS results files are available. Some of you have systems that you don't, the results and the information when you submit a file is automatically pulled back by your EHR system, and then it's presented to you in a MOTS area within your system. So for those of you that have a little bit more integration or automation based on the way your EHR was set up, this is probably going to be irrelevant to you. But for those of you that have to submit files to us, and then you can go in and you can get your results files the next morning, if you open those in just their regular way, they'll open in a browser, and it's a lot of XML type information, and so it's a little more difficult to read. Some people open it up in Notepad, some open it up in different WordPad, Word. But what's really seemed to be the most useful for a lot of folks based on feedback is to bring it into Excel. And when you bring it into Excel, what it does is it actually uses the columns as the different type of pieces of information that's in the result file for each client and each submission you sent. And then each row in that file, this Excel will be for that client specifically. So it really makes it into a nice, easy way to view it, sort it, redistribute it if you're someone who needs to send it out to your staff for corrections. You know, we do know that some of the substance use disorder, SUD, or addiction errors may have to be fixed by the clinician based on the type of error it is. So it's just a really easy way to do it. I do have a set of instructions, and most of you are probably going, like, why is this important? Because Excel does everything, and it will import anything, which is very true. Many wizards, many things that make Excel work phenomenally. But we have a little bit of a uniqueness with our results file, and you have to bring it in from what we've found in a certain way to make sure that you get all of the errors within your results file. So when you get your files off from your directory on our SFTP like normal, once you get it, the most important thing is you can add the .xml to the end of the file name. And then I noticed that I kind of duplicated that by saying you need to rename each file with an XLS ending, adding .xls to each file name. So actually, you just grab your results file, and then you rename it, go to the end, and put a .xls. Then you can double-click it, and when you double-click it, I get an error with the latest version of Excel that's going to tell me, you know, are you sure you want to open this file? You know, you're going to get an error. Just click yes to open it. It's going to open it, and you'll be asked if you want to open this file as a read-only workbook. And you will need to click on this Save As option. Hold on. Open. Okay, I'm having a little difficulty following my own directions. But essentially, once you name it .xls and you open it in Excel, it's going to give you an error like, do you really want to open this? You're going to say yes, and then it's going to ask, do you want to bring it in? There's 3 radio buttons, and one of them is to bring in as a read-only workbook. When you bring it in as a read-only workbook, that's perfect. It's going to bring in all your error messages, and it's going to present the information in the rows and columns, as I previously mentioned. You know, one thing is important is you do need to do a Save As option, and then you can save it again to make sure you've got it down on your computer, and you could rename it or do whatever you need to with it at that point. Pete, could you flip to the next slide, please?
Sure.
Okay. So one of the things that I do once I get it into Excel, and many of you can do it however you want. Once you get to this point, the data's in there, they're in rows and they're in columns. I like to turn it into a table. So what I do is I delete the very top row because it's not really relevant. The next row down is the one that's important. And so then what I do is I just highlight all the columns, and I highlight down to the end of the rows. And then I use my Create Table box, and I click that it has headers, and I just, you know, click my way through it, saying yes. And then typically once I do that and hit select, it will actually show as a table. Then it's got the little down arrows or down carrots that show the different options for sorting and things like that. So if for some of you, if you haven't heard of how to do this, this probably sounds more laborious than it really is. But the biggest thing is making sure you open it with that read-only workbook as the radio button, and from there you're pretty much golden. We have the results instructions for this in a PDF, so happy to send that to anybody who needs it. And if you currently have other ways and methods that are working for you, you know, you can just keep doing whatever you do. So that works as long, yeah. So I think that's it, Pete. Do I have any questions from that?
No, you just have comments that Colette said it's very different than the way they do it. And Jessica says just rename it as .xml and open it in your browser, and all the info is there as well. So there are several different ways, and maybe it's a good idea for the next EDI special webinar to take a little block and just do a little walkthrough of the different ways of how to do it. And maybe Jessica and Colette can send us their information on how they do it with their system, because we know there's a couple of big ones that the majority of the treatment providers are of the big EHRs that the majority is using, and it might depend on what type of computer you're working on, what kind of software, what browsers are you using. There are so many varieties these days in this world, in the computer world, that it can be, for one environment set up, very easy to just change it to .xml, or another one it's much easier, like Jody was saying, to just rename it as a .xls and then double click and make it in the table and work it that way. So there's several different ways. It would be really nice to get that information, and then maybe in one of the upcoming webinars we can have a little special about it. Does that sound like a plan, Jody?
Yeah, that sounds excellent. And it's always great to be able to learn from each other on different ways that you're doing things. For those of you that do, have to work through these results files. So, yeah, I think it's a great idea, Pete. Thank you for adding that in. Yes.
Yeah, and a good comment from Colette, different versions of software. She mentions they have 2016 Excel. Those things make a difference too. Which Windows version, which tool version, which app versions, which browser. So many differences can make it a different procedure. So okay, so that's on your to-do list, Jody. Go for it.
That is on my to-do list, exactly.
And we can work on it together, so maybe we can make it a little, so because I'm usually the one showing that, I can kind of, you tell me how to step through things, and we can kind of work on something like that. Make it a spiel. Cool. Excellent.
Be able to get that done. I mean, yeah, definitely. That's a great idea. Okay. Thanks, everybody. I didn't realize that some folks, hadn't heard about it, and of course we get into our day-to-day things, and I thought, it'd be good to just bring it up.
Excellent idea. Okay, NMS, standing for non-Medicaid services. You guys send, or maybe you're not the one sending them, but of course the majority of your billing departments is sending a lot of Medicaid services to our MMIS system, and they go back and forth a lot of times. So when we introduced MODS in 2013, 2014, we wanted to know the non-Medicaid services. And those non-Medicaid services are the ones that services that are denied, or individuals that are non-Medicaid, not Medicaid eligible. And we would like to get the complete picture. And one of the things that Rhodes is working on is to make it even better and really get the 365 degree view of the clients that we currently have, also with all the different angles and all the parts of information that we are getting. So, but a big part, of course, are the non-Medicaid services. And the service file, we ask you to send them once a month by the 15th of the following month, because then all the services are done and they're in the system, because sometimes it takes a little while before all the administration is up to date. So we recommend you to, by the mid of next month, to send, like we're almost getting to mid-September, so then you should be sending August. And just send all the non-Medicaid services that you have. So, and one of the things that we ran into is the most common errors are the client doesn't exist and the last name at birth or date of birth doesn't match what's on the file. So those two errors pop up a lot. And one of them is because the client was submitted but not accepted. That happens a lot. So you have an error and if it wasn't corrected yet, so the client has the treatment episode has not been officially accepted into MOTS. So when you send the non-Medicare services, the system will say, sorry, I don't know that client. And the last name of birth or date of birth doesn't match, also sometimes happens. You want to make sure what is used, because sometimes they get switched, or the admission date is sometimes used instead of date of birth and stuff like that. So um, try to be careful on what you use, but those are the ones that we see a lot in the files. So when a record is denied, then you cannot fix it. It's done. It's gone. We kick it back and we don't accept it. So it wasn't loaded. It was not in our system, and it will not be accepted. So if you want to redo it, and so there has to be a sort of a check flag, something in your system, and I'm not really sure how that works, but that's for the EHR folks to work on, is that it needs to be resubmitted with the correct data. So with the correct client ID, or maybe it is the correct client ID, but make sure that the status data there's a new file that's been submitted with the client accepted, and then you can send your non-Medicaid services. And the same thing goes, of course, for last name at birth or date of birth. So you have to resubmit them. There's no way we can. We debated that when we started the system. Said, okay, do we kind of leave them in limbo? And that's a little bit how, for those of you who work with gambling, the gambling system works. They kind of accept the majority of the data, and then you can go in and fix an amount or something if there was an issues. And so it kind of stays in there, and then it will be fully submitted. But we never did that with the batch submissions that we have for the mod system. And for the road system, I'm not sure what we're going to do, but maybe it's a hybrid version of the two, or maybe we stick with this because it was working fine. So never change a winning team, they say. So why change something that works? If it ain't broke, don't fix it. So yeah, that's what we wanted to show you one more time. So especially with the most common errors, and they have to be resubmitted, because if they are not accepted, they're not in there. Did that come with any questions, or was I clear enough? There we go. Okay, and then we go to Jody again. Well, of course, it's EDI, so it's semi-Jody Kramer show, right?
Well, evidently today.
Complete all fields. Go for it, Jody.
Yeah, for some of you, this is information that you're probably like, yeah, I've heard of this before. But we have a lot of new people that are getting the opportunity to submit MOTS and work with us, and so we just wanted to remind folks that in some of your MOTS, in your MOTS forms, some of you may have forms, some of you may have different areas within your system where the MOTS data is captured and collected. And so many of the fields are required. There's a large bulk of the fields that are required, and these all must be completed for a client. And some, again, EHR systems have built these requirements into their forms or the areas where you put the data in, and sometimes cannot be submitted without that field being actually populated. Then we also have what are called situational fields, and these are fields that are in certain times they become required. An error will be generated from MOTS on your results file that we just talked about for a blank situational field that is now required. And a couple good examples of these is when the expected source of payment is going to be the Oregon Health Plan or Medicaid or a CCO. Now the prime number, which for some of you, if you're wondering what is a prime number is essentially their client's assigned Oregon Health Plan ID number. And so that prime number becomes required if you've told us that the expected source of payment is going to be OHP Medicaid. And also for the prime number, there's, specific formats of those ID numbers, an alpha and numeric combinations. All of these fields are available in what we call our MOTS data dictionary. So if you don't have the MOTS data dictionary or you're unfamiliar of where it is or what it's at, please send us an email or a message, and we can make sure that you get a copy of the most current one, which is still a few years because we have MOTS is in a state where we're not making changes. So, but that data dictionary goes through all the fields. It goes through what your EHR captures for the data that we require. Any type of parameters and special things in there are noted. It's very inclusive. Another example is the DUI arrest field. The total DUI is populated with, say, 2. It had 2 total DUI arrests, but the total arrest field is blank. So for some of the values that you capture, those are arrests. And it doesn't make sense. If you tell us there's 2 DUI arrests, well, the total arrests would, at a minimum, have to be 2 because it would include those 2. And if they had additional, then, you know, it could be higher than 2, but it would have to be equal than or greater to or greater than 2. Again, that'll create an error. Also, if the treatment status, for example, you send a discharge or completed MOTS form for a client who has completed all of, say, their DUI diversion, or if they're DUI convicted, they completed their program, but the completion date in their addictions area of fields is blank. Well, it's going to come back and it will tell you that you know, you have to have a DUI completion date if you're telling us they completed DUI treatment, right? The date's important for a number of reasons on our side. Oftentimes this is associated with maybe getting their license back, things like that, which is super important to them if they've, you know, worked for where they're at and completing treatment. So we want to make sure we have all that data. Do you have any guidance on what, there's a question that says, do you have any guidance on what to enter when a client says many for the number of arrests?
If somebody has many arrests, what do you put there? Well, for some, 2 is many, and for other, 25 is many. So it's that's so difficult to answer. I'm maybe ask them to give a rough. Less than 10 or more than 10. I like that. Yeah. So,
Oh, yeah, that's a great one.
yeah,
Yeah,
excellent.
thanks. Yeah. Yeah, the ODL and the driver's license does become required for DUI, and we have had folks using 9s as a placeholder, and that's what we were instructed folks to do. If you don't have it until you get it, you can put 9s in order to get it to go through.
Yeah, Jody, can I speak to that briefly?
Yeah, sure, absolutely, Justin. Go ahead.
This one's kind of one of my pet fields, I guess. So the driver's license number is required for anyone who has a DUI legal status, whether that's convicted or diversion. It has to be an Oregon license number. We don't want anything out of state. And we understand that some folks don't have an Oregon license or an ID number at all. But if they've had a DUI charge, that information has gone through Oregon DMV, and they have a number in their system that matches the format of the license number. We call it a DMV assigned reference number. And you as the provider or the client themselves can contact DMV and get that number and then enter it into MOTS to fill in that place, you know, to cover up those 9s that you might put in as a placeholder for a while. And that way we can get the actual license number or ID or the DMV assigned reference number.
Awesome, Justin.
Thank you. Do teen arrest count to that number? I think yes. If we say total arrest, they're total arrests. Any other questions?
Yes, the data dictionary on the website is the most up-to-date one. And like I said, MOTS has been in a frozen we froze MOTS essentially well before the pandemic. So if you're seeing documentation that says 16, 17, 18, 19, 20, those are correct. People on our team keep those up to date. So yes, whatever is out there is the most current.
Okay. Guess who? Jody.
That's me. Okay. So this actually says switching from CE to EDI, but well, actually, if some of you are on here, possibly we do have folks that are entering manually through the web portal, and they are getting an electronic health record system that can send to us electronically, or you may have one that is now going to be capable of sending. This is relevant to you. We also cover it here because we know there are, system upgrades to a new, completely brand new system, or maybe a brand new platform, things like that. And these are some kind of 10 steps that we have found lessons learned that really help. So us and in the long run, in the success of your project, it really helps your organization. So number one, let us know if you're going to change, thinking of changing, whatnot. That way we can make sure and have enough resources assigned. Usually it's myself, Pete also helps, and Kayla, and then of course MOT support is there to, help us all. So let us know first and foremost. The second thing is if you're getting an electronic health records, or your current system is going to be creating a way for you to send data to us, really see what that MOTS functionality is. And what I mean by that is, what is the business process for you to be able to send data to us through electronic means? How does it work from the time maybe a client walks in your door to when you actually, or your system sends it to MOTS? How much staff time will be required, and who will do what steps? There's no one way that's better than another. There are just differences in workflows, but it is important. It's kind of the myth that, well, we're going to go electronic, and so we don't have to do anything. Everything's automated. Even the ones with full integration, there are, sending files back and forth. There's still always some administrative things that have to be done. There's always pieces of your staff putting information in where it needs to go. So it's really important for you to understand what that functionality means, instead of just being like, yep, we have MOTS functionality. Okay, well, that might impact you and, the way that you spool up resources or change your business flow for your staff. So this is what we've learned from others that have told us it's been very helpful. Project timing is important. Letting us know ties in with that. There's a process for switching data submissions if you are client entry, manually entering, to go to EDI. And there's also a process if you're going from one system to another. The Secure File Transfer Protocol, SFTP, you may hear that at times, the acronym. That is just a location where either you or your system brings your data to MOTS and drops it off, like your files, and then it picks up the information, or you pick up your results files the next day. If you're changing systems and you currently have one of these where you send data, it's going to stay the same. So it'll work. It's going to be your assigned spot regardless of which system you're using. So we don't have to reset that up if you're going to a different system. We do need to look at client ID considerations. If your new system or your updated system is going to be changing the IDs, then we need to make sure that's in alignment with what we currently have in MOTS. We may need to update them. Defining your business processes is just super, super helpful and important on the front end. That way you have a realistic view of what it's going to take to get things done in the new way. We do test the files that you're going to be submitting through EDI. So even if you are, say, going to a new system and they're like, we already have 10 organizations using it, we submit fine, that's great. But your organization will test your files individually with MOTS through the certification process. And we do that because of all of the flexibility and, things that have been built in to customize your workflows in the same system that another one uses. We want to make sure that everything's lined up when it comes in, and all the data mapping and everything is what MOTS expects. So you'll go live, and then we'll do some follow-ups. And the follow-ups really are as much as you want, from weekly, biweekly, monthly, whatever you need. We just, once you're live, it's kind of nice when you're getting real-time data and business flows going back and forth. If you have questions and need some clarification, or there needs to be any tweaks done, then that's, those are good work sessions to talk through some of that stuff. So with that, Pete, I'm going to give it back to you, and unless we have any other questions.
Thank you, Jody. I did not see any questions. Excuse me. I did see Susie making a comment about getting the reference number, that it's a little harder than just calling. I'm not familiar with the process, so that could be true. I'm assuming it's true, but maybe it's easier for the individual to get that reference number, that they don't have to go through those hoops. So maybe that's something that's possible. So
For the driver's license.
Yeah, to get the reference number, even if you don't have an Oregon driver's license and you're not from the state, but you get a DUI.
Yeah. Okay.
That maybe that's another way of doing it. So maybe ask the client. Okay. Questions and answers. We've had a lot of questions, and hopefully we gave everybody enough answers. So, but if you have any more answers, there's always the MOTS support. As I mentioned at the beginning, a recording of this webinar will be posted on our site in that training tab. We have several different tabs, and in the training, you'll see information about training and the webinars that we are providing. So on that site, there's also the next one coming up, and that should be October 5th. And it's more focused on client entry, but it also has any changes. If there's major changes going on, we'll keep kind of like a general. It used to be a big difference between CE and EDI, but they kind of merged a bit also since all the other systems started to come into play. So for those of you who would really like a classroom training, unfortunately, we have not had any green light on starting those up again. So we used to do once a month. We had one available for people could sign up, and if there were more than four or more, then we'd have the training, like in the morning or an afternoon. We schedule them throughout the year, but they're still on hold. So we do, for those of you who like a training, we do have the one-on-one FaceTime that we can do with the GoToMeeting, and then we can kind of give you a step through the system, explanation of the data, and how the systems work. So for those of you who would like that. Any questions that I've missed?
I don't see any. I don't see any questions. Let me see. I think I'm scrolling to the bottom. One thing I will say is that just thank you to all of you who attend and you stay till the end and you participate. The sessions that we have coming up for the provider engagement sessions are Teams meetings. You do have the ability to actually raise your hand, to speak verbally, to put questions in the chat. So as you're attending those sessions, please be interactive. Please let us know your thoughts. We're taking note of all of these as we're moving into that. But again, I just want to say thank you all for taking the time out and for always being an interactive group of providers with us. We appreciate it.
Excellent. Thank you, guys. Well, thank you all for joining us. And these are the contact information for one more time. This is Jody, Mary, Kayla, and Justin. Thank you, guys. The MOTS website and our MOTS support email team. So thank you all very much and have a wonderful rest of your day.